Thank you. Good evening, Chair Harrington and board. I am just going to warn you, there's a lot of information this week, so I will try to move through it for you. But I also want to make sure that we address all your concerns and answer any questions that you have. So we can go to the next slide. So as normal, I just like to start with an update on where we are with our statewide case count. And you can see that we're just under 139,000 cases cumulatively in Oregon. And our cumulative state case rate is 3,230 cases per 100,000. Never imagined that last February, and we'll talk a lot more about our 1-year anniversary, the kind we don't want to celebrate next month. Unfortunately, 1,882 Washington County residents have lost their lives to COVID-19. Very sad. And the statewide 2-week moving average for new hospitalization is 195 hospitalizations per week, and that's down slightly since the last time that we did talk. So we can go to the next slide. So this is the county, the Metro County metrics, and a little bit of good news here. You can see that each week our cases per 100,000 have gone down. And in the last 2-week time period, we were down to 289.4 cases per 100,000, and our test positivity is also going down. So that's good news. We just need to stay vigilant so that we continue to see these numbers go down. And you can see that that is true also of our neighboring counties in Clackamas and Multnomah County. So next slide. So I wanted to give you an update. This is hot off the press. Late yesterday, we learned that the governor was making announcements and did make an announcement regarding changes to the current sector guidelines. And this applies to the extreme risk category, which I'm sorry, Commissioner Rogers, but we still have to refer to it as extreme risk. But the good news is there is some changes based on what we've been learning. So we've been saying all along since March, we learn over time about this epidemic, and we learn what's highest risk and what behaviors reduces risk. And so because of what we've learned, there is some loosening of some of the guidelines. So for example, right now, indoor entertainment right now today, indoor entertainment is prohibited, but as of 1/29 for establishments that have 500 square feet or larger, they are going to allow a maximum capacity of 6 people. That also allows for smaller capacity, that there could be things like personal training that's happening for one-on-one training. So there is some loosening of the guidelines, really steeped in the science and what we're learning. Also with a lot of stress about the importance of still maintaining physical distancing, the cleaning regimens, and wearing our face masks when we're around people that are outside of our household. So next slide. The other change that I believe that I shared with you via email, but just wanted to revisit today, is some changes to the school metrics. One of the biggest changes is that this is really now considered a recommendation and not mandatory. And a new category was added that would allow or recommend that it's safe for elementary on-site or hybrid transition learning to happening at the schools. And if you remember, our case rate is below that 350 per 100,000. So when you look at this chart, Washington County is in the orange zone, which does indicate that it's safe for some elementary age group on-site or hybrid learning. We can go to the next slide. So now I wanted to transition quickly to information that you've probably been hearing a lot about in the news, which is the SARS-CoV variant concerns. We heard a lot beginning in September about a new variant that was discovered in the UK. And so we're over time learning more about this variant. And what we seem to be learning is that it does appear to be more highly transmissible, so it's easier to transmit from person to person. It could be as much as 50 to 80% more transmissible. But the good news is, this is mixed news slide, but the good news is that there's no evidence that it is more severe or more deadly than the SARS-CoV COVID-19 virus that we're all used to talking about. But if it's more transmissible, there could be more infection in the population, and because it's not less severe or deadly, there could be the potential, if this variant was widespread, we could see a potential of more hospitalizations and more deaths related to it. But it has to do more with more people getting it than that it's more deadly, if that makes sense. So there are some national estimates that this could be the dominant strain in the United States by March. And so we're working really hard to reduce transmission with all of the tools that we have, which we'll talk about next. But right now, as of this afternoon, there's been 3 cases identified in Oregon, including 1 case that was identified in Washington County. So next slide. So the other thing that we get asked about this new variant, and the other thing I wanted to say about the new variants is there's multiple variants. So there's this UK variant, there's a South African variant, there's a Brazilian variant, and it's common for viruses to mutate over time and to change over time. And so it's not unexpected that we would see these new variants, but it's something that we really want to watch closely because COVID-19 is so widespread. There could be mutations that are happening more quickly than you would see in other viruses that aren't spreading and aren't so prominent in the society, because the more it's transmitted, the more people that have it, the more likelihood that there's going to be mutation at some point during that transmission and infection. So we know that there's multiple variants that are spreading globally, but what we also are seeing, at least so far, and I just keep reminding you, remember how different our understanding of COVID-19 was back in March. So this is very early, but what we are seeing so far is that the vaccine does seem to provide protection against these new variants. So I just wanted to let you know that. And because we have these variants and because we're worried about their being so highly transmissible, it's more important than ever for people to wear a mask, keep distance from anyone that's not in your household, stay home if you're sick, frequent hand washing, sanitation, and when vaccine is available and you're eligible, to please get your vaccination.